Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare. Here's Jill Bowling.
Do you ever find yourself sleepy during the day? Or how about needing that afternoon nap? Or does your significant other complain that you snore at night? If the answer is yes to any of these questions, it may be time to talk to your physician about sleep disorders. In fact, it is estimated that 1 in 5 Americans has a sleep disorder. So in this month's Health Matters, we take a closer look at the Sleep Center at Cookeville Regional.
CRMC has had a sleep center in one form or another for over 10 years now. And our current facility has 4 adult beds and 1 toddler pediatric room, and we can see anyone from 3 years old to 103.
The first and foremost is that it is local and it is not far to travel. It is easily accessible, located right next to the hospital. No parking problems, and we have a wonderful staff.
We have several sleep board certified physicians in both neurology and pulmonology.
Patients who are feeling sleepy during the daytime, feeling tired and feeling fatigued, lack of energy, may be suffering from disorders of sleep at nighttime, and they are the people who would benefit from the sleep study.
At any given time, a good 33% of the American public is complaining of a sleep disorder, whether it is insomnia or one of the more serious sleep disorders.
Physicians in the community play a key role in assessing sleep disturbances. Dr. Scott Keith is an ear, nose, and throat specialist and frequently evaluates patients with sleep disturbances.
We're never going to recommend surgery as the first alternative. We're always going to try CPAP, which is positive airway pressure, and we're going to get them hooked up with a medical sleep specialist. And we're going to give them a full exam, ear, nose, and throat exam. We're going to look at their airway and try to figure out where their obstruction occurs and if they really have sleep apnea.
In the 3 studies I've had, this was the best one. They, as far as explaining everything to me, they made it to the point it's not overwhelming. The surroundings were like a normal bedroom, even with the TV on the wall. So it was great.
Well, when they arrive at the sleep center, we show them to a private room, private bath. We're set up more like a hotel than a hospital room. Try to keep the medical equipment to a minimum. Once they're hooked up, they're free to move around, watch some TV, read, try to follow their normal nighttime routine. And then when they're ready to go to bed, we do lights out, make sure everything's working correctly, and then we monitor them via the sensors and through infrared video.
We are monitoring various parameters which include like a brain waves, cardiogram, respirations, oxygen saturation, like movement of the legs, movement of the body, and we look at all the data to find out what could be a problem during the nighttime.
Basically, they can't twitch a toe or blink without us knowing about it.
All the wires, scary at first because they're hooking them to your ankles, your eyelids, your head. But really, after you get them on, you don't even realize they're there.
The ultimate goal of the Sleep Lab at Cookeville Regional is to bring better sleep and quality of life to our patients. Many patients say their lives changed dramatically for the better after receiving treatment.
Oh, I'm a new person. Completely. For someone that doesn't have it and hasn't went through it, they don't know the feeling of relief when you get that kind of sleep and that kind of rest and get up and can actually live again. It's overwhelming.
Most of the people we see come through here do have a sleep disorder. 95% of those people can be helped. Since there are almost 100 sleep disorders, there are over 100 therapies.
My way of life had hit the bottom of the barrel. It got so bad, my wife wouldn't sleep in the same room with me. I would go drive 9.5 hours to visit my grandkids for a weekend and maybe see them for 15 minutes because I was sleeping. I'd fall asleep on the couch talking to them, fall asleep at the dinner table. So that was, and my wife said, something's got to change. It's just either, and the doctor said if I didn't do something real quick, it's a heart attack. You stop. I was actually not breathing and catching myself and waking up just gasping, and not only gasping but grabbing for something to help.
The most important thing is patients with diabetes, hypertension, heart problems like heart attack, heart failure, and stroke, they need to get to the doctor and talk about possibility of sleep disorder at nighttime, which may be making these things worse.
Did you know that children can experience sleep disorders as well? And oftentimes they are misdiagnosed.
Nighttime symptoms include difficulty of breathing when asleep, snoring, apnea, restless sleep with frequent arousals. Daytime symptoms include excessive sleepiness, hyperactivity, frequent upper respiratory and ear infections, hearing loss, hyponasal voice, mouth breathing, and poor appetite. Some concerns are poor school performance, ADHD, gastroesophageal reflux, and headaches, especially in the morning and upon awakening. You may also see obesity, nasal polyps, enlarged tonsils or normal-sized tonsils, enlarged tongue, decreased muscle tone, and in extreme cases, heart failure. So if your children have any of these symptoms and signs, please see your doctor for a possible sleep study.
With children, generally we have one technician that is their sole responsibility, is to take care of that child. And we have a room that we try to make them a little bit more comfortable. We have a smaller bed, we have stuffed animals, we have a place for one of the parents to stay, and try to make it as stress-free as possible.
Continuing support and education is very important, and the Sleep Lab offers a special support group for sleep patients.
This Awake Support Group stands for Alert, Well, and Keep Energetic. That is our main focus, to educate the community. Anyone's welcome to come. We have different speakers, different topics. We have different vendors there to answer any type of questions that the patient may have about the CPAP equipment. So they can come and learn more about what's out there on the market, such as the new equipment. Also to learn more about sleep disorders, and also to see and relate to other patients or anybody that's out in the community that is on CPAP.
The machine actually took care of my restless leg syndrome. I don't have shaky legs anymore. It took care of my breathing issues. It took care of my snoring. I don't talk in my sleep anymore. I don't even move in the bed anymore when I go to sleep.
The key thing is evaluation, education, and then ultimately treatment. Sleep apnea is somewhat of a silent killer because it really doesn't bother you, it bothers the people around you, and it's like high blood pressure. You maybe won't know that it's going to cause some of the problems that it does until it's too late.
You have to know the quality, the difference in the quality of life between before and after. It's amazing. You can't even describe it.
For more information on the Sleep Lab at Cookeville Regional, call 931-783-2753 or visit crmchealth.org.
This month in Cookeville Regional News, we would like to welcome new physician Philip Elizondo to the hospital's medical staff. Dr. Elizondo has joined Drs. Carl Holman, James McKinney, Greg Roberts, and John Turnbull at Upper Cumberland Orthopedics. For more information about these and other doctors at Cookeville Regional, call the physician referral line at 1-877-372-2762. In an effort to enhance hospital security, Cookeville Regional Medical Center will begin locking the main entrance every evening from 9 p.m. to 5 a.m. Those needing to enter the hospital will need to sign in through the emergency room entrance. Cookeville Regional Medical Center was recently announced as a Live Strong Community Impact Project Award recipient. The project, created by Live Strong, the organization founded by cancer survivor and champion cyclist Lance Armstrong to serve people affected by cancer and empower them to take action, will bring proven cancer support programs to over 55 communities across the U.S. Cookeville Regional was the only Tennessee hospital receiving this award. As always, we appreciate you tuning in. Have a healthy and safe day. We'll see you next time.
Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare.